NGS, MRD, and also next generation flow has been tested in the FORTE trial, which is an EMN study in which we participated as a center in Siena University. And the particular thing is that NGS and NGF have been shown to be equally effective in determining the level of minimal residual disease. And in that trial, it seems that the arm of patient that was treated with Carfilzomib, Revlimid, dexamethasone, and then auto-transplanted achieved the best results in terms of MRD negativity, both by NGS and by NGF. The other point is that the consolidation maintenance therapy with Carfilzomib and Revlimid seems to be a little better respect to the other maintenance arm that was with Revlimid alone. And patients that achieve MRD negativity and most of all sustain MRD negativity showed the best results in terms of progression-free survival. I think the data are not yet mature to comment about overall survival, but the results seems really interesting.